Opposite side, positive-form contact. The inframedial aspect of PSIS, contact like that. What am I angling towards? Shoulder. Angling towards the opposite shoulder. Right? Drop piece. Yeah. Drop piece. Or sag piece. Drop is easier. Drop. So our contact is going to be the inframedial aspect of the PSIS. Okay. Positive-form contact. I'm going to angle towards the opposite shoulder. For a PIIN, I'm going to change my stance. And what am I angling towards now?
12th rib.
Angling towards the 12th rib. Okay. For an IN ilium, okay, I'm going to change my stance to where I'm square. Okay. And I'm going to actually lift the pelvis up a little bit, take out that pelvic slack. Okay. Set the drop, and I'll make the thrust, just like that. Okay. How about for an EX ilium? I'm going to contact the lateral aspect of the PSIS of the same side. So this would be a right EX. Okay. Make my contact. I'm going to lift the pelvis up. I just want to get rid of that pelvic slack. Okay. Set the drop, and I'll make the thrust just like that. For a PIEX, okay, I'm going to angle my line of correction now towards the opposite 12th rib. So I'm going to be on the lateral inferior aspect of the PSIS. Okay. Just like that. And the thrust is going to be, again, P to A, lateral to medial, some to S. Okay. So, for a posterior sacrum, a right posterior sacrum, I think you can use your superior hand or inferior hand, is that correct? Yes? And so let's use our superior hand for this one, and this is going to be a pisiform, more of a knife edge kind of a contact, okay? And my thrust is going to be P to A and medial to lateral, so kind of down towards my feet. All right, I'll set the drop. This is for a posterior sacrum, okay? I'm going to be real close to the table, and I'm going to thrust down towards my feet. All right, so that would be a P-R sacrum. For a sacrum that's posterior and inferior, what's my contact point? Sacral notch. Right? It'll be a lateral aspect of the sacrum in the greater sciatic notch, and this is a knife edge contact. Right? And I'm going to stand way back. I'll set the drop. Okay. And so my thrust is going to be I to S, P to A, and what else am I going to do? Add a little bit of torque, right? Lifting that segment in place. Okay. So that would be a PIR sacrum. How about an AS ilium? AS ilium? Okay. Pisiform contact, ischial tuberosity. I'm going to touch the bones you sit on. So ischial tuberosity, you can take a square stance, set the drop, and make the thrust. Pivoted stance is something you can do as well. Set the drop, and then make the thrust. Make sure you're on the ischial tuberosity and not the femur. Okay. So. How about a diversified ASIN? How do I do that? I'm going to do two separate adjustments, right? Adjust the AS and then go back and do the IN. So. Trick question. These guys are like, is there something that we're telling you? So we're teaching all this stuff, but the real secret stuff, you don't learn until you get out.
You want a P out of AS.
Real secret stuff. All right. What else? What else? What am I missing? Yeah, the Thompson. Okay, Thompson, PIR sacrum, PIL sacrum. So if I have a, let me think, a PIR sacrum. Okay. So the Thompson adjustment is where I'm going to be on the lateral aspect of the sacrum. So think about my contact is going to be on the lateral aspect of the sacrum, okay, on the side that the apex is deviated towards. So PIR sacrum, okay, I'm going to be on the left side of the sacrum. Is that correct? So I'm going to be on the left side of the sacrum, just like that, okay. And then what I'm going to do is I'm going to open up the joint here. All right, so a PIR sacrum. And you're going to cross the involved leg over the uninvolved leg. So, yeah, the involved leg over the uninvolved leg. So what I'm going to do is I'm going to be on the lateral aspect of the sacrum, okay, in the greater sciatic notch, okay, and I'm going to be on the ilium, okay, opening this joint space, and the thrust is going to be like that.
Just stand on this side.
I can stand on either side. I can stand like this. I can stand like this. Okay. I could be on this side. So it really doesn't matter. Same.
That looks right.
adjustment. And it's all the same. So I can, okay. Cool. All right, what else? What else? What's that? Base posterior sacrum. So what I'm going to do is I'm going to place a hand heel contact, okay, on the sacrum. Make sure that you're on the sacrum and not on the L5. If you're on L5, you'll make it worse. All right, so you got to be on sacrum. So second, probably first sacrotubercle would be better. And so we're going to get on the sacrum. This is going to be a square stance, okay. And what we're going to do is we're going to lift and we're going to thrust P to A. It's a real simple adjustment. Apex posterior sacrum is not a very common adjustment that I do. But if you're going to do an apex posterior sacrum, you're going to be on the third sacrotubercle, not the coccyx. And so the thrust again is just going to be straight P to A with a drop. All right. What else?
Anterior coccyx.
An anterior coccyx?
She says no.
You making a mental note of who said that?
I heard the
Okay.
voice.
He gets in trouble a lot, doesn't he? All right, what else am I missing? What else do we need to? Side posture, yeah, let's do side posture. Okay. All right. Okay, so side posture lumbars. We have push moves and we have pull moves. Okay. Let me see if I can really stretching my memory here. Push moves and pull moves. Yeah. So let's do push moves. So push moves, spinous is down. So in this case, it would be a PL listing. Okay, PL listing. Right side is up. Okay, and so I'm going to have the patient do this here. There you go. And I'm going to support up here. Okay, or you can have the patient like this, but my support is going to be here. Okay, and I want to be thigh to thigh on this setup. Okay, so we'll do a thigh to thigh adjustment. And I'm going to rotate the patient over about 45 degrees, pronation, okay? And I'm going to make my contact on the mammillary process, okay? My fingers are going to be parallel with the spine, okay? This would be a P to A thrust, okay? If I have the spinous up, so if I have a PR listing, I can make a spinous contact, okay? Spinous contact with my pisiform, okay? My fingers are going to cross the spine. It's very similar to a prone single hand contact. Okay, the patient's in the side posture position. And so my thrust again is going to be P to A. You're going to lift the segment and thrust through the structure, straight P to A. Okay, you'll torque if there's any open wedges, and obviously you're going to put the patient in the appropriate position if there's an open wedge. So if it's a PRI, okay, a PRI, I'm going to contact what lamina? Or what mammillary? PRI-M, right? So I'm going to contact the left mammillary process, so the left side would be, okay? And then you just torque to close that open wedge. Pull moves, the spinous process is going to be down, okay? Or if you're going to contact a mammillary process, okay, you contact a mammillary, it has a lot to do with the wedging, okay? So let's say we have just a straight PL. Okay, left side is down, and I want to do a pull move. And so I'm going to position the patient like this. Remember the pull moves, we're going to put our knee here, okay, and we're going to make sure that our thigh is against the patient's thigh, okay. And where does this foot go? It goes above the knee. This table's a little too high for me, so it goes above the knee, right? And we're going to stand somewhat upright. I got you.
I got you.
You got me? All right, and I'm going to hook the spinous process, okay, with my contact. Just like that, and we want to have a contact like this, okay? And we're just going to put our thumb here, all right? And when we thrust, we're going to pull towards us, and we're going to kick at the same time, okay? Just like that, okay? And if I want to contact the mammillary process, I'm just place my contact on the mammillary, okay? And again, I'm just going to pull as I thrust. Yeah, sorry. Okay. All right, so let's do pelvic side posture, okay? So if we have a PI ilium, what's my contact point? I'm do I pronate the patient over for a PI? Remember, for EX, it's going to be like this. EX, PIEX, PI, PIIN, IN. Hey, you wanted me to do this. You need to suffer just a little bit too, you know. So for EX Ilium, okay. EX Ilium, I'm going to contact the lateral aspect of the PSIS. My fingers are going to be pointing down. Okay. We're going to have a slight amount of pronation. I'm going to stand upright and I'm going to thrust P to A and lateral to medial. For PIEX, I'm going to pronate the patient over a little bit more. I'm going to change my contact to the inferolateral aspect of the PSIS. I'm going to thrust down towards the opposite rib. Okay. And still I'm going to be somewhat high in my stance. Okay. For a PI, I'm going to go on the medial or the inferior aspect of the PSIS. I'm going to pronate the patient over about 45 degrees, okay? And I'm going to thrust straight P to A. Okay? PIIN, I'm going to pronate them over a little bit more. I'm going to change my line of correction toward the near or the up 12th rib. Okay? For an IN, I'm going to pronate them the most. I won't let you fall, I got you. There you go. And I'm going to thrust back towards me. For an IN. Okay. So. All right. You're going to need adjustment after this. Okay. All right, questions? Look familiar? Yes? Hopefully. Okay, so the last one I want to show you is the AS, all right, Gonstead side posture. And we're going to be on the acetabular rim, okay? And so to find the acetabular rim, what I'll do is I'll go to the greater trochanter, and I go about an inch or two medial, inch or two superior, all right? And that's where the acetabular rim is, all right? And so for an AS ilium, I'm going to pronate the patient over about 45 degrees, thigh-to-thigh contact. And I'm going to place my contact on the acetabular rim. We can keep our hand in this position, all right? And I'm going to actually make my thrust down the shaft of the femur, okay? Just like that, all right? A diversified style of adjustment for an AS, you're on the ischial tuberosity. And it's exactly the same thing. So you get on the ischial tuberosity, pronate the patient over about 45 degrees, and then you'll thrust down the shaft of the femur. All right, good. What did I leave out?
EX pool.
What's that?
Yeah.
EX pool.
Oh, EX pull. Okay, EX pull.
And we don't have to do these on scan, do we?
Oh yeah, absolutely.
Not today.
Not today. Not today. So, EX pull. What I'm going to do is I'm going to reach around, and I want to reach around and grab the ASIS, okay, with the patient. So I'm going to reach around and grab the ASIS just like this, okay, and I'm going to have my hand in this position, okay. And this table is way too high for me to actually do this. So, so what we'll do is we'll put our leg up here, just like that, okay. And we're going to have the patient lean back a little bit. So the patient's pelvis should be somewhat perpendicular to the table, okay? And as I kick, I'm going to pull just like that, okay? And there's funky things that you do with your hands if you have an you have to pull up and down for a PIEX, ASEX. So for an IN pull, you're just going to hook the medial aspect of the PSIS, and you're going to position the patient just like that.